welcome to our webinar, The KPI Cure, How Healthcare Marketers Are Driving Performance. My name is Lara Lima and I'm part of the marketing team here at StackAdapt. Before we dive in, I wanted to cover a few housekeeping items. If you have any questions you would like to ask the presenters, there's a Q&A box on the right side of your screen. We try and answer as much as we can during the Q&A session at the end. But if we can get to yours today, don't worry, we'll follow up with an answer through email. I also wanted to mention that the session is being recorded and will be shared with you later. Now, before we dive in, I've got something for you. Look to the top right corner of your screen to find our healthcare advertising report. It breaks down why trust in healthcare ads is low and what you can do to build it back with the right message and channel mix. Now it's time to dive into the good stuff. I'm thrilled to hand it over to our presenters, Jasmine and Robert. Please take it away.
Sweet. Thank you so much. I'm going to just kind of kick it off with a little bit of intros. So my name is Jasmine Panesar. I'm a senior manager of solutions here at StackAdapt with a dedicated focus on healthcare. I've been at StackAdapt for the past 4.5 years, working across a number of areas that are core to campaign success and help with like targeting solutions, measurement, inventory, and optimization strategies. Throughout this time, I've had the chance to work very closely with some healthcare advertisers that we work with at StackAdapt and face and navigate some unique challenges in the space. And I'm excited to share some of these insights with you guys today. With that being said, Robert, I'm going to hand it off to you to provide a little bit of intro as well.
Yeah, I'm Robert Cummins. I've spent the last 10 years in ad tech as a trader, a media planner, and now I spent the last 5 years in pharma. And now I am heading up the customer success department here at PurpleLab. PurpleLab provides healthcare data for measurement, advertising, and other healthcare solutions in the advertising space.
Amazing. So before we actually dive into the core of today's session, I just want to quickly introduce who we are and how we work together. So starting off with StackAdapt, StackAdapt is a multi-channel advertising platform that helps marketers plan, execute, and optimize data-driven campaigns across every major digital channel. We're known for combining ML and AI with intuitive tools to drive real performance across inventory formats and various devices as well. And then PurpleLab, on the other hand, is a healthcare analytics company focused on powering smarter decisions through their data. So their platform helps us and other health organizations explore patient and provider populations, size audiences, measure and optimize omnichannel media campaigns, all in a no-code environment. So together, we bring a set of strengths to the table. So PurpleLab is kind of the data that powers our targeting and measurement, whereas for us, we're able to actually leverage that data and do an omnichannel campaign strategy and help optimize that data in real time. And we find this kind of combination in terms of channel activation plus precise targeting and measurement is what makes our partnership unique in the marketplace today. So just kind of kicking things off with the state of healthcare marketing and how we find it. So to set the stage, we want to mention 3 major trends that we're seeing in the market right now. First of all, we're seeing massive investment. Pharma is projected to spend over $31 billion in advertising this year. And while there's a ton of spend in the space, only 87% of consumers are actually trusting these ads, which is a huge disconnect in the space right now. Another thing that we're seeing is although traditional metrics like clicks, CTR, impressions are really important for optimizing campaigns and delivering performance, it doesn't necessarily equate to clinical behavior change in terms of driving prescriptions in an environment specific to healthcare. So increasingly what we're seeing is campaigns must focus more on prescription and real-time metrics to actually drive performance and improve ROAS. And then the final point, and finally, is marketers being asked to deliver more reach, more precision, and more proof of ROI, which is why, again, measurement is becoming increasingly important in the space. So these are some of the pressures that are shaping the modern healthcare marketing ecosystem today, and that's exactly what we're hoping to unpack throughout this presentation. So what's changing in healthcare marketing? First thing is talking about privacy. This isn't necessarily a change, but it's something that has always come up in the healthcare space. HIPAA is naturally just making it harder for us to track conversions, right? And it's also heavily impacting how we do targeting and measurement today. Now, although there are some solutions in the space that help us track pixel-based conversions while being HIPAA compliant, it's not always a possibility to do so in certain situations, which is where companies like PurpleLab come in terms of helping us compliantly target patient populations and actually help measure real outcomes in a HIPAA-compliant way in terms of measuring things like audience quality and script lift. Another thing that we're seeing is identity fragmentation is making it hard to do measurement in an accurate way. So we're reaching patients and HCPs across multiple different channels, across multiple different platforms, but these platforms aren't speaking to each other, which makes it very hard to coordinate consistent messaging across these various channels and get the main benefit of actually following a multi-channel approach. One stat that we keep in mind is people are actually 2.5 times more likely to trust an ad when they see it across multiple channels, which is why it's so important to use a single DSP or platform that has access to all these different channels so they can speak to each other and reach that single individual across these channels in a meaningful way. The next thing is just demand for measurable outcomes. So leadership wants to understand how ads are driving results, not just how people are seeing them. So moving beyond just clicks and focusing on AQ, script lift, and actually HCP level data as well. Just tying it back to point number 2, again, if there's identity fragmentation in the space and you're using multiple different platforms and those platforms aren't speaking to each other, the measurement also won't make sense, which is why it's so important to leverage companies that are integrated with real-time script level data and real-time AQ metrics so that we can actually do optimizations in real time and actually gain that optimal performance. And that ties into the final point of just early signal activation. Not leveraging on post-campaign insights and actually getting signals throughout the flight of a campaign so that it can be used to optimize throughout the course of that campaign and actually get those results that we're looking to achieve. So with that being said, I'm going to actually hand it off to Rob to kind of take a deeper dive into some of the solutions that PurpleLab has today.
Cool. Thank you for the intro there, Jazz, and the context around healthcare marketing today. Why script lift and audience quality matter? First, we want to measure real-time behavior. We know that our campaigns, it's a competitive landscape out there, and if we're measuring real-time behavior, not only are we spending our clients' money most effectively, we're also reaching people in the most effective manner, therefore making a successful campaign. So how are we going to do that? First, we got to validate our targeting. Are you targeting the right people? Are you targeting the right people on the right channels? Are you targeting the right people with the correct messaging? The way we can really help that is by looking at our AQ, and we can do that in a real-time basis. We're able to leverage PurpleLab's APIs on a weekly basis to see, who are you reaching? Are you in which tactics are reaching the right people at the right time? That kind of brings us to enabling in-flight optimization. We're also able to see not only our AQ, but we're also able to see script writing behavior over the course of the campaign. Not only are you reaching the right people, but are these people taking actionable maneuvers to finally get the right prescription written for them? So, as we go through the course of a campaign, there's 2 different measurement things we can look at. Number 1, are you reaching the right people? That would be our audience quality metrics, where we can actually see of your people exposed to your media, who's actually been diagnosed or prescribed with the particular condition you're trying to reach. Number 2 is script writing behavior. Of these tactics, which one of these are actually generating real life scripts in the marketplace? So similar to AQ, what we're going to do is take a look at, who you reached with your messaging and has subsequently went to their doctor and got a prescription written for the drug you are marketing for. And I think that brings that to the last point here, where we're going to bridge the gap between our spend and ROI. So it's unlike selling a physical good, where you can see your real-time insights at the end of the day. We have to look at the spend and the ROI and see if we're matching that up. So our tools allow you to see that in real time and then make the best decisions for your campaign to reach those people and drive that ROI. Now, how does audience quality work? Basically, we want to figure out which channels and tactics we are using that reach the right audience. And by reaching the right audience at the right time, you're going to improve your ROI on campaigns. So you're not wasting dollars on people who are not your intended audience. In traditional marketing, this seems pretty obvious, right? And there's a lot of good ways to tell that. But until recently in healthcare marketing, this has been kind of a black box. Upfront, AQ has been available marketplace, but recently we have switched to actually looking at the people you're reaching and if they're your intended marketplace. Due to HIPAA, we have to model out each audience. So only a few people in your audience are your intended target. There's a lot of different strategies on the front end when it comes to trading that can manipulate these audiences, such as how you're dealing with list saturation and frequency and all that. But at the end of the day, you really need hard identifiable data to make these decisions for optimization. So our audience quality measurement tool allows you to see exactly which tactics, which creatives, which line items are pushing the AQ, and then allows you to make decisions as a trader to put money behind the best performing outcomes. I kind of just touched on this, how to use audience quality to increase efficiency. But what we're going to do is we're going to look at our targeting and we have a defined audience. Usually that comes from our clients, and it could either be set ICD-10 codes, a certain condition. It could be a certain procedure, right? These are all things that we're able to track with our audience quality tools. So once we define the audience, we're able to build a few audiences with our different audience solutions to create a target audience, right? And once we get that target audience in market, we're able to look at the exposure data, match those exposure data up with IDs, and then in turn run that against our database of your target population. Therefore, and from there, we spit out an audience quality score, and then there you can start the process over again by looking at it on a weekly basis or a monthly basis to see which of those line items or audiences are actually driving the AQ, which allows you to make real-time decisions about budgeting, tactics, and all the good stuff that comes along with working on a effective campaign. Cool. How does script lift work? StackAdapt powers the campaign, and we are a third-party measurement solution where we are basically looking at the exposure data and running that against our database. So what does that mean for you? That we're not projecting out projections. We're using real-time data to come to these conclusions, right? How does that work? The campaign's activated. We capture all the audience IDs that or all the individual IDs that we have exposed media to. We run that through a HIPAA compliant process using DataVant that strips out all the PII and turns it into a PurpleLab ID. From there, we look at that Purple ID against your defined set of your audience. Like I said, it can be an ICD-10 code. We can look at NDC codes. We can look at procedural codes to make sure that we're matching people, to make sure we're measuring people against your actual audience definition. From there, we calculate script lift. We can look at new to brand. We can look at total prescriptions written. And then you can optimize towards those KPIs. So if you're looking at if your client wants to have refills and your messages refills, you can look at our prescriptions written. If you're looking for people who are new to brand, you can optimize to new to brand strategies to make sure your campaign optimization matches what your KPIs are for the client. Pass it over to Jazz for setting up campaigns for smart measurement.
Right, sweet. Just getting into this. So for launching a campaign, you got to look into like a few essentials, right? So number one, and I think Rob touched on this as well, is what are your KPIs? Are you trying to build awareness? Are you driving a specific behavior? Is it a bit of both? And that decision guides the whole strategy. So understanding initially what means a conversion for you, and is that audience quality? Is that script lift? Is that just a specific CTR they're hoping to achieve? Based off of that, that's going to guide who your target audience is, where your channel strategy is, and then what your success timeline is going to look like. So in terms of your target audience, let's say your goal is you actually want to drive specific scripts in the clinical environment. Are you reaching the right HCPs? Are you reaching the right patients to generate awareness? Because the prescription's a marriage between the HCP and the patient as well. is part of your strategy also reaching nurse practitioners who are also very involved in the prescribing process? So this kind of helps guide who the correct audience is. Next is also the channel strategy. So what is the right mix to maximize reach while still getting meaningful performance signals back? This could be a combination of display, native CTV, audio, you name it. And StackAdapt can help power all these channels as well. And then finally, your timeline for success. So if you are measuring scripts, does it make sense for you to run only a month campaign? Is it likely for you to be able to change behavior enough to actually get someone to write a prescription in that time? Probably not. So again, success timeline depends on various math factors based off of like budget, et cetera. But most of the time, the KPIs should align with the success timeline to make sure that you're actually able to achieve what you're hoping to achieve throughout your campaign as well. And then define your test and learn loop. So again, and I think we touched on this as well, launch with measurement in mind. So keep in mind what your key goals are and understand how you're going to measure them and try to get those signals as early as possible. So one example that we have here is like audience quality. So leveraging the PurpleLab's audiences to get an idea of like what the AQ could look like prior to even launching, so that you know ahead of time what tactics to run and what segmentation that you need. And then once you guys actually do get the AQ readings back, identify what's working or not working. So getting that in-flight line level reporting to understand if a specific channel is outperforming another, or if a specific creative is working better than another, or it could be specific audiences as well, and then updating your audience strategy. And then again, repeating this loop and then scaling what drives the most impact is going to drive the most meaningful results, especially when it comes to driving clinical outcomes. And Rob, I'm just going to hand it all off to you as well, kind of discuss how PurpleLabs helps in terms of helping planning and executing campaigns at StackAdapt.
Yeah. We have multiple DTC solutions for you. Number one, we have our standard modeled audiences that come in typically 3 distribution sizes. One optimized for audience quality. The second one balances audience quality and reach. And the third one is basically a reach play for more awareness. The second option we have is what we call MPI to DTC, where basically we're starting off with a grouping of HCPs, whether it be by specialty, prescribing behavior, diagnosing behavior, or even I find a very effective method is like a target list, where we can take those HCPs, look at who their patients are for the past year, and make a deterministic audience of those patients. So I really think that's a very good play for recency. It's also a really good play to connect your HCPs with your DTC messaging. So that is one way to do that. And the third thing we have is our enhanced DTC option, or enhanced AQ DTC option, where we have actually taken a new look at the way we model out audiences and use a different technique called differential privacy, where we're able to really push the AQ score in a HIPAA compliant manner. We're seeing a lot higher AQ on those. So if your client's really focused on AQ, I would suggest trying to use one of our enhanced DTC options. We have a patent pending on the process, and we're able to provide literature around how we create those audiences to ensure that HIPAA and our NAI remains in compliance. So we have 3 audience options that we leverage on the DTC side here. And then they all really play to what Jazz's point was earlier, is finding out who your target is. So we have everything available from AQ to reach play. So, whether you're activating on CTV or if you're activating on a highly specific messaging campaign, we're able to support those audiences through our processes.
Sweet. And just to provide like a few examples of how to measure and adjust mid-flight. So again, like let's say we have a campaign, we're running a multi-channel approach. We have some audiences via PurpleLabs ready to go. What are we looking at? So if we're optimizing towards audience quality, are we actually reaching the right people? If not, we can potentially leverage new segments, use maybe contextual segments native to StackAdapt, or even like work with PurpleLabs to create some custom audiences as well to help better define that patient population. Are there specific channels or specific areas in which we're advertising that are working better than others? Are we running like a long campaign and our end goal is like script lift, and are we actually moving the needle, right? So like we can actually see if for like an ACP campaign, which HCPs are prescribing what. Maybe we will focus more on ACPs that should be prescribing more, but are indexing very low, and then focus on them throughout like an MPI campaign as well. So there's a lot that we can do to measure and adjust mid-flight, and which is something just to keep in mind throughout like any sort of healthcare campaign we're doing this. So again, just to kind of reiterate, your audience isn't in one place and your strategy can't be either. So we've covered how to measure smarter and optimize in flight, but none of that really matters unless you're meeting your audience where they are. So whether it's HCPs, patients, or even caregivers, they're not all in one place in an online ecosystem. That's why getting your message across multiple channels isn't just a nice to have, it's actually essential when you're trying to drive impact. And again, so we know that HCPs and patients don't consume content just on native or display, or HCPs aren't just in the EHR. They're actually actively ingesting content across CTV, through audio, even DOOH. So channel and trust effectiveness can actually be gained and actually multiplied on by leveraging a multi-channel approach and having your brands show their ads across all these various channels as well. So how do these different channels actually move the needle? So CTV is huge for awareness, especially with patients. It's a high trust and high impact unit. Just make sure that your creative includes ISI for any branded recall-based ads. We also have endemic placements to build credibility and have a highly viewable placement for HCPs. Again, DOH around specific hospital systems, or even like within the clinic in like a waiting room. Or you can also do DOH around like HCP conferences or things like that to help generate brand awareness as well. And then even audio to reach HCPs or patients like while they're going to work or consuming content related to health and fitness via Spotify, for example. And then finally, display and native just to be your workhorse to maximize that reach and retargeting for these various channels, especially when powered by contextual or behavioral data. So the end goal of this is like no single channel does it all, but when they work together, you can really move the needle. And just to provide like one example, it could be like a recent campaign that StackAdapt worked on with a brand launching a new diabetes medication. So we use CTV to build a broad patient awareness campaign, and then paired that with endemic ads to reach the HCP as well. So they know about this new medication being in the market. And then also doing DOH near endocrinology clinics, and then using display retargeting with the CTV to keep the message top of mind for the patient population that we reach. And that full funnel multi-channel approach drove a measurable lift in both script volume and brand recognition as well throughout this campaign. So just to provide an example. Now, again, like when running with a multi-channel approach, why it matters is just message consistency in a privacy safe way. So when patients and HCPs see your brand across multiple channels, studies show that they're more likely to trust your brand and they're more likely to recall your brand. Also, this helps just centralize your messaging strategy, so align on tone, and then you can help actually have these different channels speak to each other. One example being CTV retargeting or even DOH-based retargeting as well throughout the campaign. And then it also helps tailor the format and not the message, again, native versus CTV versus DOH. And then pre-approved creative templates, so make sure that you have the same type of creative template across these various channels to have consistent messaging and consistent brand recollection across the campaign as well. So yeah, that basically wraps up this presentation. So just gonna move on to Q&A. Or actually, no, just to wrap up, and maybe I spoke too soon. Just some final thoughts on this presentation. And key things to just kind of take home is first, measure what really matters. So don't just stop at clicks. Although they're very important, still look at outcomes like script lift and audience quality, or even like MPI level data where it applies. Optimize in flight. So don't wait until the end of the campaign to actually see what worked. Use early signals and optimize as you go. And the final one is to actually lean into a multi-channel strategy. Through your DSP, your audience is everywhere, so lean them across the various channels is how you actually drive real impact. And now with that being said, we can go into Q&A.
Okay, wonderful. Thank you so much, Jasmine and Robert, for such a great overview of what's going on in healthcare marketing. Now we're moving into the Q&A portion of today's webinar. So if you haven't already, feel free to drop your questions into the Q&A box on the right side of your screen. As a reminder, if we don't get to your question today, don't worry, we get you an answer via email. Okay, so let's dive in. First question, I think, Jasmine, I think this one is perfect for you. Which emerging channel are you seeing the most momentum in right now for healthcare, and why?
So I would say at StackAdapt, the biggest channel that we're seeing momentum in, especially with the pharma industry, is probably going to be CTV. Reason being is just traditionally like pharma spends like a lot in linear TV, right? But linear TV doesn't provide the same level of targeting that you can actually achieve via CTV. So think about like a linear TV campaign where you're targeting maybe based off of geo only, and then converting that to a CTV campaign and empowering an audience via PurpleLab. So actually having an audience that's highly optimized towards your target patient population, but still reaching them through that like high impact creative on a CTV environment. So I would say that's actually like something that works very well. We also have integrations with Samba TV, for example, that help us forecast how much reach we can get and measure how much incremental reach we can get through like running linear TV and CTV concurrently, which is also seeing like a ton of success in the space.
Yeah, I think that's so true. A lot of the teams are curious about about CTV, but they're still figuring out how to test it responsibly. So it's helpful to hear where you see traction. Okay, next question. You mentioned using early signals like audience quality to optimize mid-flight. What is a realistic time frame to start seeing that data come in?
Yeah, being a former trader who's actually traded on StackAdapt when I was younger, I think the first week as a trader, I usually sit there and I get my front end metrics like CTR, scale, and everything stabilized. But at the same time, we're collecting data on who we're reaching, so that kind of plays into audience quality. And after that first week, I think it's very helpful to run a quick audience quality check to see who you're reaching, and then you can balance that out over the weeks 2, 3, and 4 to kind of start reaching the people that you want. And then from there, since your campaign should be stabilized by then in terms of your front end metrics, you should be able to start making meaningful insights using audience quality and script lift from there.
Yeah, that's super helpful. I think that's always that tension between waiting for like meaningful signals and acting fast enough to make a difference. So good to know where the sweet spot tends to be. Okay, let's go to the next one. We're currently relying on impressions and CTR as our main KPIs. What is the first step to shifting towards the other metrics you mentioned, like script lift? That's a good one.
So I think I can maybe take this on first, and then Rob, I'll let you chime in as well. But I think like the point of this presentation is not to outline that like these aren't metrics that are important. I think these are important, and many DSPs can use them to optimize effectively. And at the end of the day, like CTR and impressions are important when you're trying to drive awareness and understand if someone's actually resonating with the ad. Now, when it comes to measuring performance, there's also like other things you could do depending on where in the funnel this individual user is. So let's say it's an upper funnel campaign, and we just want people to recognize a specific pharma brand. Or it's a mid-funnel campaign and we want people to consider something. So StackAdapt actually also has tools that help not leverage claims data, but understand if someone actually has recalled that ad, like a brand lift study, for example, or an engagement lift study that helps us understand if someone's searching more about a topic after seeing an ad, which is also like a compliant way to understand if we've actually changed behavior. But then let's say like the goals of the campaign are to actually drive scripts over a long period of time or actually measure audience quality. Then a PurpleLabs partner comes in where we're able to kind of take these things in flight, understand if they're going to work or not. And then whether or not like we need to make that shift, I think it depends. If let's say the actual prescription that we're actually promoting depends on like the prescription volume, the flight, the budget. So Rob, I'll let you speak to that a little bit more about recommendations, but there's usually like a feasibility process that gets taken into consideration as well.
Yeah, I think that comes down to, I think that really comes down to setting client expectations. As we know, a drug like Dupixent can be used across 5 indications, or if you look at the GLP-1s, they're being prescribed at a high rate. So finding meaningful insights on drugs like that are incredibly easy, and your client should know that, right? But if you look at something like a Hemgenix, which is a very niche hemophilia drug, one conversion could mean the whole campaign was a success. So it really comes down to, as we've talked about the whole time, is like talking about your clients' KPIs, their expectations, and then looking at using PurpleLabs tools and reports to see if you can make a meaningful connection there. And that's what we're here for. A lot of people on my team are media planners, and I was also a media planner working in pharma. So we're able to kind of you're able to kind of lean on us to make sure that the feasibility is there and that your clients' expectations do align with the budget goals and KPIs that are set forth in the campaign, right?
Yeah, I think that makes total sense. And it's definitely like a case by case basis, and all the metrics actually matter, but depends on the stage of the funnel and the campaign goal, as you mentioned. So, yeah, very insightful. Thank you. I think we have time for one last question. What is the best way to evaluate if our campaign is actually influenced behavior versus just like drove engagement?
Yeah, so I could probably take this on as well. So like, again, in terms of influencing behavior, I think there's multiple signals that come into play. And it's similar to like the previous question where like as a DSP, we have countless, like billions of like contextual signals. So we can see if someone's actually searching about a topic more or like after seeing an ad versus like before seeing an ad, and use data science tools to help determine the change of behavior there, right? And we also know that like browsing-based data is actually very prominent in the healthcare space. I believe like 1 out of every 6 adults, instead of actually going to a doctor first, like they actually visit like 2 to 3 web pages online prior to actually doing that initial interaction with like an HCP. So there's like a huge amount of data there. Again, brand lift studies, leveraging like other measurement tools, and then obviously again leveraging AQ, script scoring, and even like tying the MPI data to like scripts being written as well to help drive that performance, understand what's being done as a result of actually seeing these ads.
Yeah. Well, I mean, speaking from a data perspective and the measurement partner, you can also use our script lift where we compare a control group of people who are not exposed to your media to the people who were exposed to your media, and then make a statistically significant correlation between the two. So either way, we got you covered.
Yeah, well said. I think that's $1 million question, right? Everybody wants to know what actually influenced and drove our ROI. And it's easy to get lost in the engagement metrics, but there's a lot out there that can actually prove performance. So, guys, this is a wrap up of the presentation, the webinar. I hope you liked it. I hope you found it insightful, as engaging as I did, with plenty of valuable takeaways to apply to your own strategies. I want you to keep an eye on your inbox. We'll be sending the recording tomorrow. So if you have any additional questions, don't hesitate to reach out. Thank you so much for joining us, and I hope you have a wonderful day.
All right. Thank you.
Thank you.